So this video will be demonstrating a running suture with this pattern. Essentially, the external aspect will be straight to the patient. The underlying aspect will be at a diagonal, either coming from the left to the right or from the right to the left. That is simply going to depend on your hand preference for sewing. Again, if you are a right-handed suturer, you're going to start on the left end of your incision and pull to the right. And if you are a left-handed suturer, starting on the right and pulling to the left. So initially, when we begin this closure, we're essentially completing a simple, uninterrupted, right? Because we're only going to cut off one aspect of the suture itself. And this is quite a long suture. This is a proline. I like proline because of how it glides through the material. Wonderful for vascular closures. But because of its length, and we don't need all of it for this patient, we're simply going to do a hand tie here. Now you're only going to cut off the one end. You want to keep that relatively short. Certainly if it's inside the patient, if this was a fascial closure inside the patient, you could cut that even shorter. You want less material to have to be reabsorbed by the body and less material that can actually be irritating to the body. So here's my knot. Now if I'm going to proceed in this fashion, what I want to do is go close to the knot on the contralateral side. So I want to go again close to this material, close to that knot, coming halfway through. Your first one always looks a little odd. That's normal. Now, instead of going straight across, as we did with this pattern, now we want to make the line on the outside look straight. So the way to do that is, instead of coming straight in here, I'm actually going to move down just a few millimeters and proceed back through the side that is closest to me. Go ahead and pull all of that suture material through, making sure that we don't have that end stuck down within the wound. And now the way to get the line straight is to go straight across. So if you can kind of pull that suture across, kind of get that marker in your mind, and that's exactly where you're going to go back in with your needle, again coming only halfway through the wound, because what we want to do next is we want to move down a little bit, right? Because we want that external line to be straight. Now the reason why I like this closure is, I believe from a cosmetic standpoint, it actually looks good to the patient. Again, that's nice and straight, but we're going to have to move down here just a little bit. Pull all the way through. And once again, if you were to imagine an imaginary line, take that suture across your patient, you would be able to envision where that next insertion point needs to be. And once you get in the hang of this, you don't need to really utilize that suture material across your patient. But certainly in the beginning, it's helpful. Again, nice straight line. Again, walking down just slightly. Coming completely up and over that patient. Again, just for the sake of practice, go back over, relatively straight, halfway through your wound. Now, one thing that you'll see mistakes being made is people will think that this can be utilized as the closure at the end of the laceration. So if I was at the end of this wound, for example, remember that the suture material needs to pass through both sides of the wound So it needs to come to that side closest to you, and then we can actually close this wound. And what we're going to need to do if that's the case is we would have to use this last suture. So had you pulled this completely through, you actually, as I did, you need to back that out so that you can utilize this loop to close with the remainder needle. And again, if this is a shorter suture, you can certainly do a instrument tie here. If it is a longer suture, you can proceed with a two-handed or a one-handed tie. Always, if we're doing a two-handed tie or an instrument tie, we want to do that double tie around. Remember, we're mimicking then that friction knot, that surgeon's knot at the end of the closure. Proline, different to ethylon or nylon, ethylon being the brand name, tends to be a little bit more slick. Again, it has less memory, but also tends to be a little bit slicker. So again, just a way to demonstrate, even though this is on a suture pad, that's more of a straight line on the external aspect versus a definitive diagonal. This is certainly done for speed. This is done on the outside of patients for slightly more cosmetic closure. And again, it becomes very easy then to remove, because as you would remove this suture, you would want to cut each individual, and again, using the angle of your suture scissors, but you want to cut each individual under and cut it on, rather than cutting directly in the center of the wound and potentially causing an issue with that wound if it in one area hasn't completely healed. Cut toward one side or the other, and the nice thing is that we'll always leave a slightly larger tag on one end, and that just simply makes it easier to take out. We're going to go ahead and cut this here and be able to pull all of that through, and that way you're pulling less suture material through the patient.